Carol has asked if you can define what is meant by processed red meat.
Yeah, I mean, it's a meat that has undergone certain chemical and heat treatments, and particularly it has had preservatives such as nitrates and nitrites, which are there to prevent botulism. So it's things like bacon, sausage, any deli meat. So, you know, our kind of ham slices, turkey slices, those sort of things. Yeah, so I mean, I think in the UK it's mostly bacon, sausage, deli meats would fall under those, but it's the nitrates and nitrites that particularly get converted in the gut to nitrosamines that are then the cancer-causing agents. And then the follow-on question everyone asks always on my course that I run on plant-based nutrition is, well, what about the nitrates in vegetables? No, they don't get converted to these same N-nitroso compounds.
How is that? Just because they're different nitrates?
No, well, just because they come packaged with, you know, nature's protectors. So it's the antioxidants like the vitamin C and the lower protein content compared to meat. So, you know, you'll hear some people saying, well, it's fine if you eat your bacon with your green leafy vegetables, there's reduced production of nitrosamines, and it's true. So, yeah, it's all the other package that the healthy plant foods come in that mean that you don't fall the toxic nitrate compounds.
So the patient comes to you on their first appointment, they've got unilateral symptoms, they contact you 2 days later and say, I'm starting to feel the pain in the other leg now. That should be the instant red flag that you think, right, okay, off you go to A&E. But what's worth noting, and you know, I've read a lot around the subject, is that up to 50% of patients with radiologically defined Cauda equina syndrome will only have unilateral leg pain. So bilateral leg pain is important because it is a strong indicator that there is a Cauda equina compression likely, but don't assume that because they only have unilateral leg pain that rules Cauda equina out. It certainly doesn't, and according to the literature, in up to 50% of cases there may only be unilateral leg pain.
Turning that literature around, of those people who are referred for urgent investigation because they have bilateral pain, how many turn out not to have Cauda equina?
Single figures. It's it is very rare. But again, it comes back to the timing. It's important that you get it right, because if you don't, the consequences are catastrophic for the patients and for you. So anything that raises that index of suspicion is an overused phrase, but if anything that raises your index of suspicion should trigger an action, and we'll talk about what those actions might be.
Does that mean that you have honed your communication skills to a high level? Because you said you might do less treatment than is expected and a lot more explaining. And presumably there are a lot of processes involved in that. There's not worrying the patient unduly, but there's also getting them to comply with what you want them to do and understand what it is you're trying to explain.
Absolutely. You know, one of our colleagues, you probably know, Oliver Thompson, talks a lot about words matter, communication, and I agree with that entirely. You know, you've probably seen it a lot in private practice where patients come in and they look petrified because they've been told they've got osteoarthritis and nothing can be done for them. But it's making them understand, you know, well, making them sort of basically communicate what their perception is of osteoarthritis, and to show them some statistics, some information, and actually explain to them, you know, it's not the end of the world. Things can be done to make you move better and manage yourself better. The other thing that's what I would say is, in terms of compliance, one of the things I'm very big on and evaluate is taking measurements. Not so much range of movement measurements, because in practice you would get tied up with degrees and things like that. But I use a lot of strength measurements, handheld dynamometry, certainly around the hip, pelvic and groin complex. And I've created almost a way to profile my patients per level of activity, whether they're sports, whether they're amateur, whether they're inactive, and I know what I would expect them to hit in terms of numbers. And that's quite a nice way to see them through a management plan of while they do things to help themselves, and we can control that situation really well.
Yeah, so now we're moving on a little bit more to being specific to see whether actually the muscles around the neck are an issue, or if there's some cervicogenic issues for the onset of some of the symptoms.
Okay.
So we'd be looking at trying to put the neck into different positions to see whether that brought on any of their dizziness or dysfunction. One of the easiest ways to do that is to get somebody into a swivel chair. So if I just get you to sit down there, Nicola. So we want to take out the element of the vestibular system, but just look at whether the neck is bringing on any of those symptoms. So I would stabilise Nicola's head in this position and just ask her to rotate 45 degrees and back again to the other side. And now just do that a little bit faster, Nicola, so you can just spin from one to the other. And I'd probably get her to repeat that, 10 times or so.
Yeah.
And if she was dizzy in that situation, then, that's a pretty clear indication that the only thing that's happening there is neck torsion, and that she's
You're about to get your mic ripped off, I think.
Essentially what you'd be looking for then is, what are the tissues that are being sort of stretched and moved in that situation, and could it be the stretch or the contractions of those muscle tissues that are creating this sort of altered cues to the visual and cervical oculomotor reflexes, and then giving rise to that sense of dizziness or just feeling off.
Yeah.
I think some of the cervicogenic dizziness symptoms are much more subtle. People will describe it, Cam will probably corroborate this, but that they'll describe it as I wouldn't say I was really dizzy, the room's not spinning, but they just feel that the floor feels like it's coming up towards them, or they just feel just off kilter.
And all of this, of course, tells us, your notes have got to be very, very well kept in these cases, haven't they? You've got to make sure you've recorded everything that you've asked, done, seen, been told.
Definitely. Document. Document the negative responses as well as the positive responses. Yeah. Do you have any changes in your bladder or bowel sphincter control? Obviously, you're going to ask the appropriate questions. But if they say no, don't ignore that then. Record that there is no change in bladder or bowel sphincter
Would you
control.
simply write no CES symptoms? Would that be enough if you've gone through all the questions and they're all negative?
I tend to do BBSASD, and then it's B0, B0, SA0, SD0.
Yeah.
If I've asked each of those questions and there's no symptoms within a BBSASD with a 0 next to each of them, is enough for me as a note that I've asked the questions and the patient has said that they don't have any.
Yes. I remember talking to Lawrence Butler about keeping good notes, and he said abbreviations are fine as long as you're consistent with them.
Absolutely.
He also said it's useful that other people within your own practice or who might see those notes understood what those abbreviations meant.
And BBSASD is well used within spinal services, so that would be recognised by anybody who worked in a spinal unit.
From what you've said, it all sounds quite academic, whereas the people watching this show are going to be thinking, well, actually what I want to do is I want to grow my business as a physiotherapist, osteopath, chiropractor. So why are people going to give us money? What's the purpose of the grant?
Universities aren't going to give you money, but we are going to help you find out where that money is. People like government have to give you money because the government needs to grow the economy. Opening another restaurant next to 15 other restaurants is not going to grow the economy, it's going to dilute the economy. Mm-hmm. But opening the only Korean barbecue in a place that is full of Chinese takeaways, that's something a bit different. They're looking for some way, some new offer. Maybe you're the company that's invented the flying car made of cheese. Yeah. So government has to give out money to grow the economy because you're not going to do it yourself. We want to invest 2.4% of GDP in research and development. There's lots of funding for that. There are 4 main areas that they want to do that in. Data and AI, obviously everybody's heard of all the data and AI work that's going on at the moment. Healthy ageing, we're an ageing population. So the government has to make sure we do that in such a way as we're not an increasing burden on the NHS. Future transport, because we all need to go places and the car, as was, is no longer the way forward. And everything to do with sustainability, carbon capture and the environment. And any mix of those 4 things, there's going to be funding for the next 10 years in advances in those things or better uses of those things.